Um, and I said, I don't think that's the way that they were doing it at the other hospital. And she looked at me and she said, "Excuse me, I've been a nurse for 20 years. Please don't tell me how to do my job." So of course I started crying because I was certainly not, the put together person now that you see before you. I was an emotional disaster, and I started crying and I said, I'm so sorry. I have a 4-week-old baby at home and I just want to get home. I didn't mean to offend you. And she looked at me and she said, "You've got a 4-week-old infant at home?" And I said, and a 3-year-old. And she looked at me and she looked me up and down and she said, "Well, I guess you're not breastfeeding, are you?" And I know, the audible gasp. And that was just obviously callous on so many levels. My doctor, who I talked to you about this morning, Dr. H, who was my colorectal surgeon, she canceled a vacation to stay with me. I can't even imagine the level of devotion that she canceled a vacation to stay with me because I was in such unsteady state at that point. Now, my sister always likes to interject that maybe she was going to visit her in-laws and she didn't want to go. But nonetheless, she canceled a vacation to be with me. And again, I realize that you cannot change the test results that you are delivering. Facts are facts. But the way in which a test result is delivered makes a huge difference. So I was, after my first surgery, I had been pinned down in a strange way, and I had no feeling in my left hand. So, numbness. And they did an EMG. Anyone who doesn't know what that is, it's that needle test where they poke you with needles to see if you have a response. And after the test, the doctor who delivered those results looked at me and she said, "Well, the results are inconclusive, so either you're going to regain feeling in your hand or you're not." It's like, really? So you just stuck me with needles for the last hour to tell me you don't know if I'll regain feeling in my hand? And again, I was crying and she basically said, "Well, we'll know in about 2 years," and walked away. So my message to that is just always keep in mind that the things you say make a critical difference to the patient. And there was no great way to deliver those test results. They were inconclusive. But a little compassion, I think, would have gone a long way in that situation. Home in the hospital. But my mom took me into the ER that morning, and as I said earlier, I had the J tube, the G tube, an ostomy bag, and 3 or 4 IR drains. And the ER nurse who admitted me looked at me and she said, "Oh my God, in 21 years of nursing, I have never seen anyone who looks like this." Now, that is not a prize you want to be bestowed. You really don't want to be that interesting when you're a patient. And so not being able to talk or communicate in any way is insanely frustrating. So the first question is, how would you want to be treated in that situation? Ask yourself that. And that is where making those personal connections with your patient really matters. I had on my bedside, on my bed rail, I had a picture of my 2 kids and my wedding picture with my husband and I. And I looked nothing like that wedding picture, I can guarantee you. People thought I was 80 years old. I was bald and I was about 75 pounds. And for people to come in and look and see that that's who I was, and to talk to me about my kids, even though I couldn't respond, made a huge difference. I'd be talking sort of like I wasn't in the room at all. So they'd be, saying, "Hey, are we going to order Chinese tonight? And, oh, what do you want? I'm going to have the Kung Pao chicken." And I would be lying there, obviously looked like I was completely out of it. And all I was thinking in my head was, I like Kung Pao chicken too,